Hi everyone, welcome back to my YouTube channel. Before starting the video, if you are new and have not subscribed our YouTube channel, press the subscribe button. In today's video, we will learn about the major areas of social work. Introduction. Social workers work with a diverse population of people of all ages and with a wide range of challenges. Social workers have a wide range of responsibilities, from offering assistance to persons going through difficult times, emotional stress, or big changes in their lives to clinically diagnosing emotional, behavioral, or mental health disorder in individuals. They not only assist individuals in coping with the circumstances at hand, but they also help professional social workers. Workers advocate for them and look well for valuable resources and other form of assistance. Number 1. Child and Family Services. As a specialty field of practice within the profession of social work, child and family welfare is regarded to be a unique area of practice, and the principles and values of social work professions are generally consistent with the policies that guide modern child welfare organizations. Children, as well as their parents and guardians, can benefit from the services provided by social workers. In addition to supplying information on resources for children and families, social workers coordinate services and assist clients in contacting local and state authorities as well as community based organizations. Child and family social workers also work with parents to give them with supportive casework and advice on how to be a better parent. Additionally, social workers provide support and counseling to children who have been victims of trauma, loss, or extra-family abuse, among other things. The planning and delivery of a variety of services for children and families is the responsibility of social workers in child and family welfare agencies. These services include things like family support and residential care, advocacy, adoption, and foster care programs, as well as child protection. Social workers guarantee that children live in safe homes and that their fundamental needs are satisfied in a family environment that is supportive of their development. These services are performed in an efficient and professional manner because of the importance of services. Number 2. School social work. School social workers are trained professionals that specialize in assisting kids with school related concerns and personal problems that interfere with their ability to function effectively at school and at home. Professional social workers who are involved in school social work provide as a link between community resources and students who require specialized services or accommodation. In the field of student support services, school social work is seen as an integral component. The primary purpose of school social worker is to improve the general functioning and academic achievement of pupils in the school setting. School social workers collaborate with other members of the school team to assist kids in reaching their academic potential. Geriatric social worker. Geriatric social workers provide services to elderly individuals and provide them with help in a variety of areas. Social workers who work with elderly people aid them in maintaining a healthy and happy lifestyle in society. Social workers who appreciate the values of service are better equipped to grasp the perceived needs of the elderly and to demonstrate enough empathy when providing the services. People over the age of 65, whether they live at home or in an assisted living facility, require the assistance of social workers. The nature of the challenges faced by elders in urban and rural families differ to a certain extent from one another. As a result of their education and training, social workers are uniquely qualified to provide much needed assistance to the elderly through a range of programs and services. Number 4. Mental health services. A variety of services are provided by social workers in mental health, including establishing partnership among professionals, caregivers, and families collaborating with the community, usually with the goal of creating supportive environment for clients. Advocating for adequate service, treatment models, and resources, challenging and changing social policy to address issues of poverty, employment, housing, and social justice, and supporting the recovery of clients who have experienced a mental health crisis. A mental health setting is typically comprised of services that fall into three basic categories of medical care: prevention, treatment, and rehabilitation. The values of service motivate the professional social workers to specialize in a single area of practice or to practice across all three in order to respond to the diverse client, family, and community needs in the most effective way possible in order to provide the greatest possible benefit to those who seek their service. Number 5, medical and public health services. Medical social workers provide support to those who are suffering from serious or chronic health problems. They provide information to people and families about how to deal with disease. They also learn about resources that are accessible to sick people and their families, such as nursing care, nutrition classes, and therapies, among other things. Medical issues have an impact on much more than just the body. They can result in a slew of emotional, economical, and social requirements that must be met. Social workers are skilled at assisting people in meeting these types of requirements, and as a result, we can find social workers in a variety of settings where health services are provided. Medical and healthcare social workers are the official names for these professionals. Number 6, community social workers. Social workers working in the field of community development can be found in a wide range of contexts and in a wide range of practice areas. Systematic concerns that contribute to social problems are addressed by social workers who approach their job from a community development or community organizing viewpoint. A great deal of the time, they may also be engaged in the kind of individuals' problem solving techniques that are characteristic of many social worker roles. Understanding the power dynamics and social relations that control the relationship between various structures and diverse communities, as well as trying to achieve social justice through structural change, are essential components of community social work practice. Community social workers assist in the proper functioning of their respective communities. A small number of them work directly with the individuals, completing needs assessment and referring them to available resources in the community. Thanks for watching. Don't forget to like, comment, and share. Subscribe for more videos.